And here in South Africa, a broad range of civil society organizations have launched a survey which will establish whether communities have access to their life-saving chronic medication and food. The survey will look at just how easy or hard it is for communities to get to their clinics and hospitals as COVID-19 tightens its grips on these communities. Now, the survey, among other questions, asked whether people are able to collect their ARV treatment without a problem and if HIV services are available at the clinics. We have asked Sibongile Shabalala, the chairperson of the Treatment Action Campaign, to join us now via Skype, as she hereby does. Sibongile, very good evening to you. Thanks for joining us. Welcome.
Good evening. Thank you for inviting me.
Oh, it's an absolute pleasure. Great to have you on this show. Now, what's the biggest challenge, Sibongile, that the HIV and AIDS community now faces in the wake of COVID-19?
The biggest challenge is that people that are not getting their treatment adequately, and the biggest challenge is that since we are facing the COVID-19, it seems like all the focus is turning on the COVID-19, which is okay. However, we cannot neglect the chronic diseases that we are already managing in the country. And we know that people who are living with HIV have the viral load that is compromised. So if they are not getting their medication in time or correctly, it means that their life will be in danger because their immune system will be compromised, and it will be easy for them to be infected with any disease, including COVID-19.
So, Sibongile, having been in the forefront of activism in the fight of such pandemics, what do you think should be done? What approach should authorities adopt in dealing with COVID-19?
I think the best way is to approach the strategy that we used in fighting HIV, to exclude civil society or communities in the fight of COVID-19. I think it's a big mistake. Now what we are seeing is that the government is focusing only on the civil society, particularly that is sitting at SANAC. But we have a broad range of civil society in the country that can assist in fighting COVID-19. And COVID-19 affects people on the ground. People on the ground, they need to take action and they need to participate in fighting this disease. So as we did with HIV, we came up with strategies, we came up with a possible solution. Today, we are the country that has the biggest rollout of HIV. So we should learn from that. But it seems like our government is taking long to learn from that.
I guess that is the big question. Our government, as you say, is taking very long to learn from that. Where are the activists? Where are the people who can drive activism to coerce government to take proactive action in as much as they did in dealing with HIV?
Activists are there on the ground, and activists are meeting almost every day. We have structures that we already developed since the COVID-19. We have C19 People's Coalition, where about 250 organizations who are working on the ground are part of that coalition. And we are responding in other issues, and we continue to engage government, although in some cases they don't respond to our letters and our statements. However, we won't get tired. We will continue to engage them and until we be heard. As you know, as you heard yesterday, the president was talking about increase of grant and sustaining communities unemployed. That is our call as activists. We've been calling since before the lockdown to say government has to meet communities in the halfway. So that is our first victory, to say at least we are here. So now, how do we strengthen our strategy of advocacy, especially on health issues? Because we know that health sector will be affected mostly at this time, because everything has to be taken to the health sector now.
You know, just a short while ago, we ran an insert with regards to Africa's response to COVID-19 and the dealing thereof, catching the attention of the WHO, who loaded the country's, or rather the continent's, approach to coronavirus. So, I mean, in terms of treatment, in terms of research, in terms of containment measures. So what would you attribute this to compared to our wealthier counterparts?
I think for now, as a country, we are trying to do the good thing, but Then, as I'm saying, there are gaps. There are issues where the government has to listen to us on responding to COVID-19, because we are on the ground. We know what is happening. We are facing these challenges every day. So as a country, if we want to win this fight, we need to work together, and we need to come together as we did with HIV. So this is the time. Hence, as people living with HIV, we developed this survey. Today, we just launched another pamphlet, which is COVID in Our Lives. It's a simple English where everybody can be able to learn. And also we interpreted it in 11 languages that are spoken in South Africa. So we are hoping to reach a wider community with that pamphlet that we launched today.
And by all means, Bongile, we need to mirror our approach to HIV and AIDS against the approach that we should adopt on dealing with COVID-19. And one of the key facets or the aspects of dealing with coronavirus is the issue of testing. I mean, with HIV, testing is free, but with coronavirus, it is costly. Hence, we are encouraged every now and then to go for testing.
Yeah, we encourage people to go for testing, especially for coronavirus. And now, as activists, we are calling for the testing of HIV, because we know that there are a lot of people who are living with HIV. Some of them, they don't know their statuses. So as they are testing for coronavirus or for COVID-19, they need to also test people for HIV, because we know that, as I've said earlier, people who are living with HIV, who are not especially on treatment, their immune system is compromised. So we might see more deaths on those people, especially because they are immunocompromised. So that's why we are calling for government to test more people and to put people, the 2.5 million who are not on ARVs yet on ARVs, so that we can be able to sustain people on the ground and be able to save more people's lives.
I guess that's the gist of my question, Sibongile. How then do we increase access to testing, just removing the financial element of it?
As we are doing with HIV, we have tents and mobile testing that is happening in every way. So even with COVID-19, I think we should take the same approach, and that will help us to be able to test more people. However, we cannot do that if our community healthcare workers on the ground are not yet well trained, because that is the problem that we are seeing. They are expected to go out and test people and screen people, but they are not well trained. So how do you expect to get good results if you haven't trained people? So the government needs to train community healthcare workers and recognize community healthcare workers as the frontliners, because it's not right that they are only recognized when there are challenges, but after that they are sidelined. So that is not what we agree upon as civil society, and we are against that, and will continue to fight for community healthcare workers.
You know, scientists all over the world, including South African scientists, are still hard at work trying to find a vaccine for COVID-19. How then do we ensure that we don't wait for, the treatment to be available in those developed countries and the developed world, and then we wait for negotiations for that particular vaccine to be, filtered down or available on the third world? Because that could take months. And time is not, we don't have much time. We're still on a vigorous race to save the human race.
As a country or as a third world class, we need to recognize our intelligence. It's not like that in Africa we cannot do anything. We have scientists in Africa. We have geniuses in South Africa. We've seen a few days ago there are students in universities who are working very hard to find a vaccine and to find prevention of coronavirus. So those research that is happening in the continent, it needs to be recognized and be supported. That will help us to be able to fight the virus in the continent. So we need to recognize ourselves and our intelligence. We shouldn't undermine ourselves as African. We can do it, and we have capacity and we have resources. So we need to take out those resources where they are supposed to and be able to get what we want.
All right, Sibongile Shabalala, the chairperson of the Treatment Action Campaign, joining us via Skype. Thank you so much for your reflections. Much appreciated.